I'm gonna do my best to explain my symptoms. Right now, it's just mostly pain everywhere. It's like a headache, neck ache, then like an overall flu ache. Then my joints, especially my wrists right now and thumbs, knee, um, right heel and toes, just overall pain, joint pain, and the muscle pain. It feels like a belly flop burn while being beaten with a cane, and it varies from area to area, but mostly my calves and like forearms right now, and the palms of my hand, the heels of my hand. Okay, and really bad brain fog. I can't even remember what I've said so far. Nausea, really bad nausea that comes and goes. My toes feel frozen, ice cold. My feet feel really cold. My hands aren't that bad right now. And sometimes I'll just start sweating, mostly on my forehead and face. But okay, this is all going back starting, I think, September 2022. My girlfriend convinced me to go to the ER, and we found out I'm diabetic type 2. After that, started on some medications, just oral medications, and I felt amazing. Found a new doctor to take care of that, and we found out I had low testosterone and sleep apnea. And what was the third one, babe?
No, that was the three. That was diabetes,
Oh,
sleep
okay.
apnea, and low testosterone.
Low testosterone. So, but I had diabetes under control. My A1C was terrific. Blood sugar was pretty good. Started a new diet. Kat helped me with that, my amazing girlfriend. So I was eating well. I was getting more exercise. Just feeling great. So we thought we'd tackle the testosterone. So my doctor started me on the topical gel. I was on that for a few months. No change, no effects felt. So he decided to start me on intramuscular injection. Took the first dose of that. No change. 2 weeks later, took the second dose. Following day felt amazing. Next day after that, same third day until about 3 o'clock in the afternoon. It felt like I hit a brick wall. Worst fatigue I've ever felt in my life. So dealt with that.
You had a fourth injection.
I know I had a friend of mine suggested, who takes the same thing, suggested I take a half dose the following week instead of waiting 2 weeks for a full dose.
And you cleared it with your doctor.
Asked my doctor, he said that was fine. So I did that. Still feeling the fatigue. Then headache and neck ache started.
Then you
Did the same the following week with a half dose. Shortly after that, fainted in my girlfriend's mom's kitchen. Just flat out passed out. While I woke, I got up from the couch in the living room, walked to the kitchen, and just dropped. Woke up shortly after, not hurt or anything. So a few days later, the fatigue was really bad, so we decided to go to the hospital, right? To the ER.
Your symptoms were severely worsening.
Yeah. By then, I think I was started the shortness of breath, maybe.
You had multiple symptoms coming on at once.
So we went to the ER. They did their usual blood work, head CT, chest X-ray, and everything came back normal. So they sent me home, told me to follow up with my primary. I did. I'm kind of vague on what happened.
There were multiple trips to the ER, and you were admitted after.
Well, when did he start me on the dexamethasone?
September.
Yeah, it was mid-September. After at least one more ER visit, he started me on dexamethasone.
Well, I thought that was after you had been in for the Rocky Mountain Spotted Fever.
No,
that was before then.
It was before then. It was that same visit he decided to do those tests.
Yeah, which tests?
The Lyme panel, full NA, a lot of stuff.
What came back positive?
And the Rocky Mountain Spotted Fever came back positive. He wanted to start me on just oral doxycycline, but I decided to go to the ER.
And you had to go to the health department?
Well, they admitted me right away and started me right away on IV doxycycline. I was in there for 5 days.
3 days.
The first time?
Yeah, and then 7 days the second time.
Okay, I thought it backwards, but can't remember anything. And saw the infectious diseases doctor there, and she informed me that she didn't think it was a current Rocky Mountain Spotted Fever or infection or acute. She thought the antibodies were historic, so I had it in the past.
Because you had a positive, then a negative, then a positive.
Yeah.
So after they decided that it wasn't an active Rocky Mountain Spotted Fever,
they sent me home, told me to follow up again with the primary, and had me on oral doxycycline, for 2 weeks. But shortly, a week and a half later, I was back at the ER, this time with vertigo.
Yeah. That's when you started titrating the
doxycycline, yeah. The dexamethasone, yeah.
Yeah, there was dexamethasone.
It had screwed so bad with my blood sugar, it was all off the map.
So the second admittance to the hospital.
God, I can't remember now.
You were extremely weak. You couldn't stand. You were confused. You had difficulty with short-term memory. You had difficulty with word finding. You had severe vertigo. And your blood sugar was high, so we got you to the ER and you were admitted a second time. And the second admittance, you were there for a week.
Yeah. Again, they ran IV doxycycline again.
Yeah, and then they decided that that was not the appropriate treatment because you had no signs of active infections.
Yeah. So they were just treating my symptoms, running a lot more tests, keeping me under supervision. But, after
spinal tap
came back, with nothing. Head MRI with him without contrast, nothing. They sent me home again.
And then when you were extremely symptomatic several days later.
Then like the body temperature stuff really got really bad. And the symptoms were just getting worse. The pain was starting really bad.
You attempted to go to Daytona, they wouldn't admit you.
Yeah, I went down to Daytona, they didn't admit me. Then
Went up to St.
Then
Augustine.
we went up to St. Augustine. They wouldn't admit me, sent me home.
And then tell them what happened
Then
at Mayo Clinic.
Then we went to Mayo after the same night as Flagler Hospital in St. Augustine. And after waiting in the lobby for 8 hours, after 6 of which they hadn't tested my blood sugar, after me telling them I was diabetic, and no food, barely any water, they told me there was nothing they could do. Basically, I was wasting their time, and I was not to stop going to the ER because they wouldn't be able to help me. So back to the primaries, and by this time, had I switched to...
Yeah, you switched PCPs.
I switched PCPs.
You were seeing specialists through secondary care.
Yeah, I started seeing the specialists.
And who did you see?
I've seen 3 neurologists now, 2 endocrinologists, 2 rheumatologists.
2 neurologists.
No,
I said 3 neurologists.
3 neurologists.
Pain management.
Pain management. Psychiatrists. Physical therapy.
And acupuncture.
And the only thing helping me all through all this time is the acupuncture and some cannabis.
What about like the migraine medications?
They didn't really help. I mean, the meds I'm on barely help. I'm not on any opiates. I'm not on any heavy stuff. But yeah, I don't know what to add anymore. I'm done.
So where are you presently today?
I have in-home nursing now. And I got the approval to go to Mayo to be admitted through the chronic pain department.
Mm-hmm.
So I'm really hoping I'll get some answers soon.
What's your present level of functioning?
Barely any. I get maybe a good hour out of the day. Usually in the evenings, I can push myself pretty far. But every day, like, my pain scale shifts higher. It's like yesterday's 10 is today's 9. You know, only to find out there's a new 10 kind of thing. So, and the nausea keeps getting worse.
How's that impacting your life?
I have no life anymore. Luckily, I have an amazing girlfriend who puts up with me and, you know, does everything I need and more. So I can't drive. My legs have started giving out on me.
Your fall risk?
Yeah. I've almost fallen over many times. My balance is shot. I don't know what else to add now.
So, final thoughts?
Luckily, I've been able to stay positive through this whole mess, you know, and I have a lot of support. Could still use more, though. But yeah.
All right.
I can't think of anything.